Hi everyone, good day and happy Women's Month to all women who are doing amazing things, across different fields, the healthcare, construction, and many other fields. Women have constantly defied odds, and this is the month where we are spotlighting women who, are beyond inspiring, who have done a lot in the space of healthcare. And we're not being biased, but obviously the HSB podcast is really focused on spotlighting healthcare and how healthcare business is being done. And I am very excited about this month in particular because, this is the opportunity to shine the torch on women who have done exceptionally. And I have a very, very phenomenal woman. But when I read her profile and I read all the things she has done in the healthcare space, especially in the private health sector space as far back as 2016, I was like, wow, it's such a privilege to be able to even have the opportunity to engage her and learn some of her lessons in her journey to pushing healthcare at the forefront, across the continent of Africa and beyond. So today I have the privilege of introducing Dr. Ritgak, and I'm just going to allow her to just, share a little bit about herself and, also introduce herself to the audience. So over to you, Dr. Ritgak.
Thank you. Thanks so much for having me. As you
Oh,
said, my name is Ritgak Tilley-Gyado. I trained as a medical doctor. Over time, my work has evolved into global health and development work,
wow.
where I currently work for the World Bank as a senior health specialist. So the day-to-day work involves designing and supporting government to deliver very large-scale human capital programs. So in primary health care, large-scale nutrition programs that improve early childhood outcomes. Many of these are multi-sectoral and complex. This working with government really, sort of is an opportunity to bring together the intersection of maybe all things that I've done in my career or over the course of my career, starting from the evidence side and research and consulting stint that I've had, and then working with the private sector, which you mentioned, because I think very importantly, the government's not able to scale everything for the size of Nigeria, scale all critical programs and services on its own. Private sector partnerships are really critical. And then more recently, over the last, decade plus, working more on the policy and financing side.
Mm.
And so should I say my current baby is around early childhood development and how critical it is for inclusive economic growth, not just seeing
Wow.
it as a social imperative, but an economic strategy for Nigeria.
Oh my God. I feel like just you just saying this, you're a very well-rounded healthcare professional, like from policy to consulting to health. Wow. Definitely, these are the kind of women we need to spotlight. I remember I just went on YouTube, and I saw a video of you as far back as 2016, actually fighting for digital health startups in Nigeria. And I was like, what? Dr. Rich Gang has been doing this far back as, while I was still in, undergrad. And I was like, this is really, really amazing. And that begs my question. You're a medical doctor. At what point what drew you to that healthcare? Why, normally doctors, they're in hospitals, but you did something different with your career. You decided to pursue the biggest problems and, pushing things at the grassroots and making sure they should. What drew you to this field? What made you evolve into this field? Do you ever see yourself in this field, maybe? Yeah.
So very interesting question. I definitely saw myself in this field, but not in this way, or I saw myself in this way, but not in this field. And when I
Mm.
say in this way, in the way of sort of impacting people and lives, it's always something that's been very important to me. But I do have another side. So before I went to medical school, I studied architecture for a year.
Are you
So there is a different side of me that's not in this workspace. However, as I thought about, what to do with my life, with my career, I knew that I needed something that was going to impact people. But I was also looking, to be honest, very practically at, if, what's going to give me a sustainable job. About that, I just said to my friends,
I love
I
that
just,
fact that you mentioned that. Yeah, that's very
yeah,
important.
it's very practical because sometimes, I mean, we want these sort of really purpose-driven responses, but
Mm.
sometimes it's just, oh, my parents thought it was a great idea and I did it, right? Of which, by the way, my parents not both of my parents thought it was a great idea. My dad didn't think it was a great idea. My mom thought, oh yes. So, but I went ahead to medical school and studied medicine. And I mean, medicine is a fascinating field, fascinating, sort of aspect of our lives that really, I mean, one can never fully get their head around when you start to think of how nerves, the neural system or the neurological system works, or, and how that sort of makes muscles and joints move. I mean, it really is fascinating. In the course of studying, I had to do many electives, and I chose to do one of my electives in Nigeria in the National Hospital or in Abuja. In the course of my work, I think I was a bit, in the course of that elective, I was a bit sort of taken aback by what I saw. I'm sure that things have gradually improved over time. But at the time, we had a patient. She was 5 years old. She had these bullae with like big blisters, massive blisters all over her legs and severe joint pains. And we kept having to sort of pass on her files between the pediatrician, the hematologist, the orthopedic doctor at some point, a nephrologist at some point because of her kidney functions. And I think at some point they had asked for a few tests, including a CT. The CT scan was also relatively new to the system at the time, but broken down for close to 3 days or so. And every time we would go on ward rounds and we would get to her bedside, I would play with her. So everybody called her my friend. And I remember going home one day and coming back in the morning, and my colleague told me that we had lost her, sadly. And for me, it was, just it just brought so much home because she also had very a unique caregiving environment. Her parents were separated and she was sort of left in the custody of a relative. There was just so much on the social side, on the systems side, that I felt could have,
Been better.
could have been better placed to give her a better outcome.
Yeah.
And so for me, that was like a pivoting moment that, me going into the clinic patient by patient is going to be very small scale impact, important impact, but small scale. And that led me to go back to school and, after graduating, just start work straight in public health and then build on that with further studies in behavioral science and the behavioral science bit, because for me, it's everything that happens is about behaviors and incentives, whether it's, political decision making, whether it's policy decision making, how we incentivize systems or actions that drive systems to deliver results. On the demand side, whether people seek care, how health workers behave, the people they meet, how the public sector receives partnerships and investments from the private sector or regulates them, vice versa. Everything for me around public policy really links to behavior.
Mm-hmm.
And so, of course, there are many other factors in that, but I see behavior as a very critical centerpiece. And so that's why I went to further my studies in that space and continue work in the public health and development space.
Wow, such a very inspiring story. I can imagine how you felt several years back when you met that patient. The fact that you can still tell the story means that that was actually your biggest wire. I love to ask that question because people that I found one of my guests in the podcast said something. He said, healthcare is not just a job; it's actually a calling. And obviously, from the way you have acted, I mean, literally just going to see some of your archives from 20 years ago. 16, obviously, that really struck a chord in you, and I'm glad because you've actually made a lot of impact in this space. So thank you to that patient. May her soul rest in peace. But definitely, I think that was a defining moment for you. So thank you, Dr. Ritgak. And obviously, like one of the themes of this podcast is local leadership. And some people might be asking why local leadership? Why are we not talking about global leadership? I think the reason why we named it local leadership is because oftentimes we get carried away about global, global, global. We forget to actually work in the local context. I had one of my guests say something about you can't take Harvard, knowledge and come to Zamfara and implement. You actually have to understand the local. So I'm just very curious to know you have been someone who have done a lot of things grassroots, right? Actually for a long time now. What would you say local leadership means to you, in the space of healthcare?
It's very interesting, the analogy of the previous speaker to say you can't bring Harvard to Zamfara. Actually, I would say that you can,
Mm,
and perhaps you must. So for me, local leadership means those people who are close to the problem are a critical part. I won't say the entire sum of it, but the critical and probably the major part of the solutioning, right?
yeah.
Providing the solution. The things that global development offers us is global experience and evidence. When you
Mm,
have metadata or cross-country studies and
yeah.
comparisons, are collected over time, the longitudinal data. I think what it offers is broad themes, right? It
Yeah.
says globally, these are the frameworks, this is what works.
Mm-hmm.
Now, of course, then you come to the country context, and unless and
Yeah.
until those are then rooted in local institutions, local knowledge, local accountability, you're not. Then, unless and until you do that, you're bringing Harvard truly to Zamfara.
Mm,
So I think I'll start, but I'd like to start with what local leadership is not, because so ever so often, because and should I say the global sort of geopolitics, maybe perhaps at this point in time, is encouraging of countries to look introspectively. But that means that countries must and local leaders must show up in certain ways. Local leadership is about more than titles, right? So it's
mm,
not about big titles. It's not about sort of borrowed concepts or jargon, piecing things together without the evidence backing, or about mantras, because also it's very difficult to divorce what we would call local leadership from
mm-hmm.
sometimes what is the, pure politics of it. There's politics in everything, but the pure politics of it versus the kind of political leadership that is required to translate some of that evidence into action, into systems delivery, into impact, into results. So I think that local leadership for me means one, acknowledging the problem. If whatever the data says, we can never say data is perfect, but data gives us a sense, it's a signal of where challenges are. So first of all, being able to acknowledge the data and acknowledge the challenge and acknowledge the problem. Two, being able to, do some solutioning in an evidence-driven way, which means, yes, we're looking at these global frameworks, but we're also looking at the local evidence.
Mm,
If we have tried this in this country, how has it worked? What has made it work? If we haven't tried it before, then being honest and upfront that this is, at this point, a policy experiment, right?
mm,
And then three, building the institutions to deliver. Because no matter how great your ideas, concepts, and even sort of socioculturally and context savvy they are, in the
mm-hmm.
absence of strong institutions that were with clear accountabilities, clear mandates, and so on to deliver, it's not going to translate to impact on the ground. And that, of course, with those institutions translates into delivery systems and so on. So there's a deep technical and political work that allows solutions to endure. The two need to go hand in hand. And that for me is true local leadership. So when we say local leaders, for me, it's who is willing to do the
Mm,
difficult work of bringing the evidence to the table and allowing for interrogation of that evidence, no matter how uncomfortable it is, and also acknowledging what we don't know,
yeah.
right? So being able to say,
The
yes,
constraint.
this global framework may not work for country X, but we also don't know what yet works for country X, but we're
Mm-hmm.
willing to experiment in XYZ ways.
Yeah.
I think one other important dimension of local leadership is, collaboration and partnerships, mutually respectful ones.
Absolutely.
You have local leaders, whether it's communities or it's government. You have actors outside of that ecosystem, whether it's academia, development partners, private sector, civil society, who all have a role in shaping how that outcome emerges. And so I think really creating, for lack of a better word, a very big tent. When you have a big development challenge, you need a big tent and you need everyone to come into that tent to really work hand in hand. So, I think development is inherently collaborative, and so that's what I see as those are some of the elements I see that are important for local leadership. And
For
then
sure.
maybe lastly, for someone like me who's Nigerian but works for a global institution and works in Nigeria, am I local or am I not? This is a question.
You are. You are.
Exactly.
But
And
you're
so
global too. I think you're both.
right. So this is it. So how do we define a local? Because sometimes that also determines who gets a seat at the table. Oh no, this is a
Mm,
local, the country conversation versus global. I think one can be both, like you say. I think you can be deeply rooted in the global ecosystem or sort of work in the global ecosystem, but also be deeply rooted in the country, its institutions, and its communities. And so I think for me, our ability to, from whatever platform, as Nigerians, as locals, being able to, and I don't really like the word locals, but as those who belong to this country and to this system, being able to, be driven by the commitment, the accountability, the proximity to the problems, and proximity to the evidence and solutions, and try to bring those together to really solve them is where leadership really comes to bear.
absolutely. And I think you've done a phenomenal job in this space, defining both local and global leader. Because I've seen your work and I'm like, what? Like literally, she has been preaching for digital health startups in Nigeria as far back as almost 15 years ago, like when nobody was even talking about digital health. I think you are an example of just borrowing that global mindset and global practices and making it local. I think that is something that we need to emphasize more because until you understand the local context, understand what works within the space, you cannot really say you're an expert in that domain. Yes, you might have it, but until you try grassroots, right? Not theory, practical. And I think you've done a phenomenal job doing that both in Nigeria and globally. So this is just amazing. I'm just so inspired to even have the opportunity to chat with you as a senior leader I'm looking up to in this space. So thank you, Dr. Ritgak. I think we're gonna go on into just continue the conversation around, the Women's Month and as women, I'm sure you have a lot of stories and tales to tell because obviously, as a woman in leadership who have done a lot in this space, trying to fight for lives, fight for people's life, you have your stories, and I just want you to share a little bit with us. The theme of this month is like give to gain, right? How do we talk about leadership journey, especially for younger generations who are just coming up in the space? And some of you, I mean, obviously you have a lot of experience in this space. What would you say has been one of the biggest, impact in your journey so far? And like who has given to you on this journey, this leadership journey, and how would you say that made a difference in your career, even as you went on your leadership journey?
Yes, because sort of come full circle on the women's leadership thing, and it may not be
Mhm.
in the way that many people see it.
Hmm.
I mean, International Women's Day, Women's March being the month that we then sort of expand that frame and celebrate women. It's really, really critical. Women do give a lot, whether from either side, especially in societies like Nigeria, even as we're sort of, moving into a sort of much more urban family and work structures. I think women still do give a significant amount, whether it's caregiving, child rearing, the professional space. And they definitely do not get enough credit for any of it, especially in the workplace. It's very easy for women for a lot of erasure to happen. We've read it in many of the women's leadership books, right? Where concepts like sort of mansplaining have come up, and you have,
Mm,
colleagues explaining to you concepts. And perhaps for me as a doctor, I've had someone, a non-medical person, trying to explain a medical concept to me,
mm,
just as an example. Or you get in a room and, I'm not one for titles and things, but you get into a room, the men get called doctor, and you get called by your first name. And I'm sure as a younger woman, and I've talked to many women who've gone through sort of the leadership sort of, or risen through the ranks, and it's very interesting how some of the similar things. Oh, I wore glasses to look older, or I wore a wedding ring to be more respected in the room, and so on.
mhm.
So some of these challenges are very real,
Very real.
and we shouldn't minimize them at all. And
Absolutely.
that's why for me, the give to gain, I would flip, and I've flipped for myself, gain
Mm,
to give,
mm,
because women have been giving, they continue to give, right? Have they gained?
Mm.
Some, yes, but there's
Mhm.
more to gain. So if we want more women to give to society, then we need to, it's like this concept of filling the cup, right?
Mhm.
You can't pour from an empty cup. So before we are being asked to give more, I think we should gain more. And that's more in political leadership seats. That's more on panels. We had an exchange about a month ago where a set of stakeholders were coming onto a panel discussion. It was a big panel, 9 people, including the compare moderator presenter, and it was all men.
Wow.
And they were going to touch on things like maternal health, maternal human capital, adolescent girls' education, and so on. It doesn't mean that they can't be close to the issues, right? These are fathers, these are brothers, these are husbands,
Absolutely.
but there is a space for inclusivity. There is a space for representation and allowing women's voices on the table. So, but that means we as women must recognize that agency and be able to assert ourselves where we need to. It also means then as women, and that's one thing I haven't seen enough of, women don't support women actually,
Mm.
contrary to what is popularly said. Women don't support women. I'll say that
Yeah.
very categorically. Some of the most challenging work relationships I've had have been with women. And so we need to probe that a little bit more, right? What does women supporting women
Looks
mean in
like.
practice? And how authentic can we be about that, right? It's not just a slogan. Can we really genuinely see the next sort of young woman, give her a chance, give her a seat at the table, and so on. So those are maybe some of my reflections. I've been fortunate to have many good mentors. So I can't list them all, and learned different things from different people, from some intellectual honesty, from others, just ensuring that, one of them said to me about focus on impact, basically. One of my mentors said to me that, don't worry about who gets the credit so long as the result is done or the impact is made, right? So it doesn't matter at the end of the day. Well, they say that, but I took that then and I did a lot of work that I didn't put my name on.
Mm.
But actually now, as I'm growing older, I'm saying, well, this is how the erasure of women happens, right? You say, I'm just solving for impact, and you're focused on the result and you're getting the work done. And trust me, someone will glide through and scrimp that result and claim a narrative ownership or narrative theft or revisionism of what you've done. I've learned from others. I think integrity is really important, and integrity is both in terms of what you do and how you do it,
Mm.
and it links to the intellectual honesty as well. Because unless for countries like Nigeria, unless and until you're bringing that intellectual honesty to the work, and it's easy to tick boxes, it's very easy to tick boxes, but ticking boxes are not going to develop a nation.
Mm.
So that intellectual honesty to say when things are going well, but also to constructively say when there are changes to be made. And sometimes it's difficult, right? You may be the only voice in the room who is, something looks glamorous and everybody's, sort of forging ahead. Insofar as you're convicted about your intellectual sort of standpoint,
Mhm.
I think it's something that I've also learned from my mentors. I've learned diplomacy from some mentors as well. And I can't even say I'm fully there yet. I'm sure you can see, and I don't think women need to be diplomatic all the time, but that's for
Mm.
another day. I think sometimes assertion is additional assertion is required, but it's very important. I don't even want to call it diplomacy. I think building your social capital, if I can sort of broaden it, because I think everyone has something to bring to the table, to the conversation, to the work. It's just about how much of that good you're able to see versus the things that you may consider challenging.
Mm.
And one of those mentors said to me, he said, even if it were the devil, we would work with him, and I think his point was, no matter how bad a person is on the ball, what is the result you're trying to achieve? You want to make impact. And so you're able to sort of strip it of those external things. And then a very powerful woman once told me a trick. She said she had to find the moving train, and in her context, that moving train was an older Caucasian male. And she said she just attached herself to him and just rode that train. I won't call her name, but extremely senior global figure that
Mm.
we all know.
Mm.
So, I mean, I've had the good fortune of, I think the good fortune of really meeting many, many, many people along my journey who have just given me a chance, who have believed in me. I think that's the most important thing, that when you start to demonstrate commitment and credibility and people give you a chance, because not opportunity is not equal
Mhm.
to everyone. And so I want to specifically actually shout out the Pan African Women in Health, platform, because I
Yeah.
think it's doing exactly that. That we recognize some of these challenges. We know that the bottlenecks. There is a glass ceiling, if you want to call it that. And so we have to be deliberate about making those opportunities visible, linking people to those opportunities, and supporting people when they get those opportunities.
Yeah.
Because sometimes you get a platform that may be bigger than your experience or your capacity at that point in time, but you have the potential to grow into it insofar as you are a learner and have that authenticity and that intellectual honesty. And what is then required is to support people into that. And I mean, like, people with credible backgrounds trying to, sort of make a difference. So I really appreciate Paul for being able to create that space for African women as well. And lastly, I'll just say maybe intergenerational mixes. There's this sort of notion of, awaiting your turn, and it's an interesting one. And as I've grown older, I've come to understand a little bit where it comes from, because
Mm.
these are people with 3-4 decades of experience, and that means they've seen a lot and they've seen life. They've tested out some of the approaches that you're trying to test out now. They've tested out 3 or 4 times in the course of their
Mhm.
career.
Yeah.
They've gone 4 times around the issue, and so there's something to be gained there. But I think that it's important that doesn't close the door on
Mm.
allowing younger women into the room, giving them a seat at the table, allowing them to bring also those fresh perspectives and those, sort of, I mean, do you know how to use TikTok, right? Or do you know how to use AI to
Mhm.
make presentations? There's always something to be gained from working intergenerationally like that, or supporting each other intergenerationally.
Wow, you said a lot. Like this, I feel like what you just said is a master class. Maybe we need to book you down for 24 hours to teach us everything, because I feel like these lessons you've been reeling out are actually very real. Like starting from where you started from, flipping it from give to gain to gain to give. I think I never thought about it that way, but really we need to gain to be able to give, because if we don't have more women. Now I joined the webinar in Women's More, what's called the referable women or something like that. The referral worthy woman. Yes, that's the webinar. And we were talking about how, 50%, there's a split, 50 to 50% of women enter the workforce, and only about, say, less than 10% get to the C-suite. And I think there's a problem in that, because if at this 24th century we're still talking about that, there is really a problem. So we really need to gain to give, actually, rather than give to gain. I really love that perspective. You said a couple of things, and I think this is a lot based on your experience, and I can't even digest it. I will probably go and listen to it over and over again. But I noticed that I can't help but notice that you mentioned intellectual honesty a number of times. And I know that, obviously you're a very intellectual person and you've done a lot of work in, supporting government, private sector, and even, the Federal Ministry of Health in Nigeria, the Minister of Health, and you've done a lot. And I'm sure you've seen that. And I would really love for you to just buttress a little bit about on that. But at the same time, maybe just another question just to add and pardon on to that is also assertiveness. And I think a lot of younger women will be listening to this podcast, right? In your journey, right? Because you've said it a lot of times, you don't want people to think you've done your work, but you didn't tell the story well. And I know that I struggled with that when I started my career. I didn't have the voice to speak up in meetings. I feel like I had this guy working with me, and everybody thought he was doing the whole work. Meanwhile, I was doing the whole work, but in meetings he spoke up, and I remember one of my colleagues actually reporting me in the global team. I was like, "Hey, what's happening with the internet? She doesn't speak up in meetings, and this guy does all the work, and they don't know I do the work." So I think that is something that younger women struggle with. I had to learn. I had to learn. Had to learn how to be loud. I'm naturally not a loud person, but I had to learn how to loud. So how would you say, and obviously you said you're still in the process, but how would you say you've learned that how to assert yourself more, particularly in the career front and even in life generally?
Yeah, this is a very interesting one. I think many women will say the same as you, that they're not the most vocal, and even if they're relatively considered relatively loud women, probably not as vocal as men.
Mm.
So as their male counterparts, potentially. So I think one of the things that has helped me is being authentic and true to myself, which means that if I go into a meeting or a discussion, I'm not going to unmute the mic just to speak for speaking's sake. I'll speak when I have something to say, and something important to say, right? And sometimes there's power in that because everyone's talking a lot, and uh, everyone's talking a lot and probably, moving the conversation in different directions. But, just coming in with something very substantive, even once or twice during a long discussion, I think is powerful enough. I think it signals to me, I see somebody do that, it signals this person is confident in what they're saying. They know what they're saying.
Yeah.
The second thing is very, very basic. One of my mentors and past bosses used to tell me when I would try to speak up in meetings as a very young professional, he'd say, your voice is just so mellifluous. It's just so soft, and so to be honest, giving your voice a little bit more power
Mm.
is just a very practical tip, but give your voice a little bit more power. And, at some point, I mean, these very practical things at some point. So I read about how I had already sort of, learned the trick of sort of going through your presentation or your speech or whatever it was before the event. But I think I somehow believed it more when I heard that Obama did it, that he would stand in front of a mirror and and do that, and so you're able to see yourself, you're able to see the gestures and the, how you're coming across. Although I don't think those things should really be a big deal, but somehow they matter, right? But the biggest thing is more is much deeper and much more foundational, which is boundaries. If you know yourself and you're self-aware about who you are, how far you've come in this journey, what you've poured into that journey, and what everyone else who has supported you has poured into you, then you're able to set your boundaries very clearly. Nobody's going to shove you around, right? Nobody's going to try and, minimize you or make you shrink into be a shrinking violet, literally. You have those boundaries very clear. When it's adversarial, you're able to really establish and speak up for yourself. When it's, just sort of, it's sometimes benignly, right? People just, it's not that they're coming at you. It's just they're drawn to the man in the room, right? But you're able to then find your space and assert your space, you assert yourself in that conversation. So I think it's both deep, and it comes from a big sort of sense of self-awareness, and that self-awareness and preparedness, let me say, and preparedness, you need to pour it into yourself. Another thing someone told me before, so early in my career, I just like, I'd come into work, into meetings, I'd just like sort of skim through the deck before we get into the conversation and so on. And someone said to me, just try settling down like a day or two before and, reviewing the material and reflecting on it. It was very basic, but I was just green in the workspace. I didn't even know what work was. I was just like, just there trying to get the job done. And it was transformative. So that preparedness, it's just an example of like that's a situational preparedness, but I mean a preparedness for leadership, a preparedness for life, a preparedness for impact, right? So you need to understand for yourself, what are the skills and qualities that I need to become that leader that I want to become, right? And that allows you to have that self-awareness, allows you to come out more, I think, more confidently. This is who I know I am. This is what I know I have to give, and we're talking about give to gain. This is what I have to give. This is what I don't yet have, but I am capable of acquiring to be able to give. So I would say, yeah, both treated both practically and very superficially, in terms of just very, looking at yourself in the mirror and rehearsing, but also very deep and fundamentally in terms of centering and grounding oneself.
Like you've dropped a lot of heavy words already, but because of the podcast is going to be very short, so we're just going to wrap it up. Maybe we need to get you for a master class and sit you down to teach us for 1 week, maybe the younger generation, because this is so powerful. You said something about boundary. I think that's something women struggle to keep in the workplace, and trying to keep boundaries with your personal life and even work with your boss, many things. I think this is one very heavy word: self-awareness, preparedness. So thank you for dropping those. I'm just going to move quickly, because this is like a master class in less than an hour. So yeah, we're going to talk about the opportunities, like how do we create opportunities for women, right? I love the fact that you mentioned the inter and transgeneration and what PAWH is. And I always see amazing women like you said. I'm always inspired, sometimes to just see some women who are doing great things. So I'm just going to ask you a question about what you would like to see in the next 10 years. What would progress look like in that regards? So what would you love to see in the next 10 years? So if we're to look back.
Women's leadership in the professional space should go hand in hand with political leadership. So those who are solving for affirmative action in the House of Representatives and the Senate. We've never had a female executive governor in Nigeria. We know that executives have very strong decision-making power. The gender balance in state and federal cabinets, those are keys to starting to unlock leadership in other sectors and spheres, including healthcare. So that's one. I think that affirmative action and that push, and I don't know really if the solution is reserved seats for women, as has been sort of advanced, or just really allowing women to compete favorably, right, for those positions. But maybe it starts with that affirmative action and just carving out a niche, a space for those seats. But it's important that when those seats are carved out, whether it's in the House of Reps or, the Senate, that they come in and it's not, or that you are a quota system candidate. There's a way that quota system candidates get treated, right? It's like you didn't fight for this.
Yeah.
You got here because we needed to demonstrate inclusivity or whatever it is. I think that's really important. And then linking that to and their studies, right? If you look at their studies, I think in terms of countries in South Asia where where you had women leading municipals and maternal mortality was crashing by about 4 percentage points relative to the other areas. And there are studies around this. So I think it's really important, even from a health leadership angle, that we have more women in legislative and executive positions. The second is then in our own sphere, right? What does success look like? Success looks like keeping from the low hanging fruits, the quick wins, keeping our panels balanced, keeping our work teams balanced, and continuing to create those platforms and those hubs where we can, like I said, link women to leadership opportunities, but most importantly, support them when they are in those leadership opportunities. Because it's one thing to get the platform, it's one thing to be able to translate that opportunity into real impact. So if I were to really, I say dream or aspire, I would say, that we would get to that 35% affirmative action. We would see the CMDs of teaching hospitals be 50% be women. We would have a female minister of health. I don't know if you realize that we've only had one female minister of health, Professor Ajinike Grange, and she wasn't supported in that role, I would say, from the stories that we hear. So having a female minister of health, having 50% of the heads of agency be women as well. These would be sort of credible milestones. The commissioners of health, we have more women there, but still, I wouldn't say, I don't think it's more than 5 at the moment, or 6 that are out of the 37 that are women. Those for me are tangible measures. If I were the one with the magic wand, I'm not, but I'll make my contributions.
Leader. Obviously, like this is really, really like I love the fact that you started from the fact that it's political. We actually need to get to the rooms. We need to get to the seats. So it's not just to make those decisions. We need women at those seats, and it's really, really important because obviously, like you said, when you started choosing your career, you realize that you have to do something from the grassroots to be able to make ripple impact. And I love that. Definitely we need, maybe you'll be the next minister of health, who knows. Anyway, I think this is really, really, I'm enjoying this conversation, and thank you for sharing that, because obviously we need to talk more about this. We need to share the challenges of women. If women are having maternal health issues, you would understand until you're a woman. You will understand what it means to have, menstrual pain and have to come to work, what it means to have. I recently heard a country has just passed a bill that women have free days off when they have their menstrual pains. So all these things are real, and we still have to do our career. We still have to face life. I think there's a lot, but I hope that we get there in the next 10 years, like you've said. So now we're gonna go into, obviously you are an expert. I really don't know what I've done to deserve the opportunity to discuss with you and also to learn your lessons. But obviously, like, you are a super inspiration to me. I have no doubt. Like, I remember when I was young, I was like, I want to work in World Bank. I want to do. I was inspiring to be in those spaces, and whenever I see a woman who has done this and not just doing development, you are still very passionate about your country and trying to see that something really changes in the healthcare sector. And I'm really inspired by your journey. I just want you to just talk a little bit about the work you're doing, like the healthcare space in general, right? In part of my MBA program at Johns Hopkins, we used to debate in class about the social good of healthcare and the profit aspect, right? And obviously, sustainability is one big thing that we have not really seen move the needle in the space, right, in healthcare. So my own question to you is, like, what are those big misconceptions, and what are those things you've seen that in your own perspective you believe will help move the needle in the healthcare space?
Sure. So I'll take this. I mean, there's a lot on the public sector side, but I think really we want to talk about the private side and the markets, right? Because on the public sector side, there's a lot that needs to happen governance-wise in terms of reforms
Yeah.
for things to happen. Over the last few years, I've been focusing on a few distinct areas: primary healthcare reforms as sort of one recurring decimal for me. Second, worked also on the health security side, on nutrition and multisectoral nutrition programming, and more recently on early childhood development, right? So really looking beyond nutrition, beyond childcare, at the integrated system and whole that children need to get the right start in life. And it's not just the right start in life, but the data is showing us very clearly that, children who falter in their physical growth or cognitive development early in life are not
Mm,
completing primary school or as whole as their colleagues who are healthy or well developed, or secondary school. They're going to the labor force earlier, into lower quality jobs. So it's a real human capital accumulation challenge. What looks like, growth monitoring in age 0 to 5, or what looks like availability of playbooks or stimulation toys or things like that, are actually sort of 20 years down the line. And I spoke to someone last week, and I said to her, how do you think the skyscrapers, the skyline that you love to admire in Singapore, how do you think it came about?
mm,
Just sort of pointing her back to countries, the East Asian tigers, and how, they may not have called it the same things that we're calling it now in the 70s, but they did make those investments in tackling malnutrition and improving healthcare and improving basic education, foundational learning, and so on. And they continue to build on those. Now, then, where's the nexus with the private sector, right? Because this all sounds almost socialist and
mhm,
government driven. But for a country, like I said earlier, the scale of Nigeria, I think very clearly the private sector has multiple roles to play. I think the first is that we're very concrete. We're in a very mixed health system, and I think it's a big mistake for us to ignore the private sector in any reforms that we're doing, because
yeah,
private sector does deliver. We've already said 60% of Nigerians are accessing care in the private sector. But
mhm,
beyond the service delivery itself, right? What's the role of the private sector in financing healthcare? What's the role of the private sector in supply procurement and supply chains, right? And that sort of links to like jobs and manufacturing and so on. What's the role of the private sector in the digital health ecosystem, like we spoke about
mhm,
earlier?
yeah,
There are just so many touch points for the private sector, but the question then becomes, which of these solutions become viable, right? That have that profitability, are technically savvy in terms of moving us closer to that impact, viable in terms of the profitability, and I think a very critical thing, able to scale. Because what you don't want is fragments of
I love.
solutions in different pockets where you're not able to standardize care for people, you're not able to standardize access or make access equitable, and so on. So, like with everything else, whether it's a policy or a technically sound intervention, the same in the private sector, whether it's an innovation or a product innovation or a service, that if the model is not viable,
Yeah.
and that means social and economic returns, it will struggle to sustain itself and to scale. So for me, first of all, I think when I think of these sort of private led or social impact solutions, first is the technical evidence, because if you ground it in evidence, and I know I keep coming back to evidence, but if you come from a problem statement perspective or a problem driven perspective, and you're seeking to solve, right? So you're seeking to solve rather than sort of ideating in from a theoretical perspective, then, and for you to come from a problem perspective, you probably need to understand the data and the evidence and the gaps. And it's not just the data in terms of, oh, the outcomes are poor, it's the systems data as well, right? It's the systems data that says this system A is unable to connect to system B because it's missing this link, right? So you need all of that sort of, sort of deep sort of data and knowledge base to be able to build something that is socially impactful. The second is then are the incentives around this solution aligned for investors, for government, for service providers, for communities in a context like ours where either willingness or ability to pay may be challenging for a good chunk of the society. Government is a likely off-taker, right, for some of these interventions or some of these products. And so you need to sort of add that or develop that solution with that value in mind, right? Or that is, where's the value for government or for my investors? Otherwise, you can't sustain beyond the sort of impact stage.
Yeah.
And then the third is just sort of being user-centered. And we call it human-centered design, right? But we see that those are some of the solutions that have the most likelihood of scaling, because you're building them around real people, around real lives. And you're building solutions that actually fit into the realities of people's lives. So you're not just bringing things out of a box. You're getting into the black box and you're saying, okay, why aren't people washing their hands enough in rural communities, right? Is it the soap? Is it the water? And then you're going out and mapping what is their daily life? Where do they source water from? Where do they get soap from? Can they afford, how many bars of soap can they afford, over the time period? What are the alternatives? And that's how you start to sort of come up with these solutions. So I think the last thing I'd say is just, our ability to see things from that market perspective is probably what will enable us to move from this project mindset, right? We have a lot of projects. They're never really big scale projects because the size of the country is so large. So even if I brought in a significant chunk of resources, I may only be able to go to 10 states. There are 37 states. But if you see the private sector as a mobilizer of capital, as an extender of services, as an innovator, and yes, it's about the bottom line, but it's about two bottom lines. It's about the bottom line, the social returns, as well as the bottom line on business. And finding that sweet spot is, I think, what makes it as sustainable. And that's why you see some products in the market for decades, right? Over time, because someone has been able to find that careful balance.
Wow, I really, it takes me back to when you started the conversation about you defining the incentives and also the behavior. I think just that summarizes everything. Like literally just finding the incentives and understanding the behavior of both sectors, both the private and the public sector, and how they can work together. And definitely, I think we need to do a lot in this space because to make healthcare work, we need both ends, both hands on the table. Because of like you said, we have a lot of pockets of pilots. You do in 7 states, you give the remaining 29 states. What will happen to them? Obviously, this will definitely equalize. And at the end of the day, after pouring out a lot of investment in a particular country, the funding stops, especially in this period where we are seeing a lot of shrinkage. We need to really come back and really think about how to make this work. So thank you so much for
Yeah.
spotlighting that.
I know. If I can add actually on that piece, the government side, because you mentioned incentives, and I think for government, the public sector side,
Yeah.
I have been a little bit on that side as well. I think an increasing openness to market based approaches,
Mm,
just realizing that we're never going to be able to do this alone,
yeah.
and opening up that space. And sometimes that means using public resources for private provisioning.
Mm,
We haven't yet seen that happening at scale in country, but that's one dimension, just sort of the openness to sort of use those public resources in that way. The second is around government itself incentivizing private participation, right? There's a lot of tax reforms ongoing, and they're really sort of focused on revenue generation. But in these social impact spheres, what are the incentives, right, that you're giving to? I mean, people are getting pioneer status for having LPG plants and things like that. If human capital is important enough, can people get pioneer status for having investments that are impacting on lives, crashing maternal mortality, improving children's developmental milestones and things like that? And then the third piece, which is probably the hardest one, is the regulatory piece, especially around products. And it's not that the regulatory frameworks are absent in their entirety. I'd say it's more around systems that enable the compliance and enforcement around regulations, around standards. I see agencies like SON, NAFDAC are doing really growing their systems and doing well, but a lot more investment and a lot more capacity needs to be built to have those systems that are able to regulate. For example, how's the private sector regulated at the moment in terms of healthcare provision or in terms of childcare? If you look at it, there may be some documents, policy standards, but are those systems for compliance, for sort of certification, standard, accreditation, ensuring compliance and enforcement when there's sort of deviation from the standards? Are those systems fully functional? I think not yet. So those are some of the things, if we truly want to enable a mixed market or market-based approaches, I think those are some of the things that need to also happen on the public sector side.
I wish they could put my brain on the screen right now. What my brain is just screaming is, I'm so proud she's a woman, and I'm so proud. When you hear an expert speak, you know an expert is speaking. Literally, if you x-ray my thoughts and my brain, I'm just so proud to, hear you speak and also just hear the expertise, because obviously all these things you've said can only be something that you've learned from years of experience and just seeing what works and what doesn't work. So definitely, I hope people get to listen to this, because obviously this is very valuable. Like, how do we, upskill public sector to be able to, push private sector investment? I think this is very unconventional thinking, and we really need to move in that direction. So thank you so much. I'm just so proud to even hear you speak. So so just to wrap up the podcast, I've enjoyed this conversation. It's been so insightful. I'm definitely going to listen to it over and over again. Looking ahead, like, what would you like to see? What's your hope for the future of healthcare system, both in Africa, where you are, and globally? What would you like to see if you had that magic wand? Let's bring the magic wand here now. And what would you like to see in the healthcare system in the future, even in your leadership space, as we wrap up in the healthcare space you're playing in?
Yeah, so that's a very interesting question, and one that I think I was asked just about 10 years ago as well, in a similar conversation such as this, the future of Africa's health systems. For me, the future of Africa's health systems is outside the health system. And that's, if I had a magic wand, that is what I would solve for or push for, that we as healthcare professionals take off our pure public health or pure clinical hat and really understand how multidimensional many of these issues that we are trying to tackle are. Whether we call them social determinants, right? But many of these issues are multidimensional. Take maternal mortality, directly links to roads and transport, right? And women's ability to get to health facilities. Take even malnutrition. The largest or biggest driver of sort of malnutrition is the mother's level of education and delayed pregnancy. So her being able to get through adolescence into a full adult, have the physiological capacity to then deliver and have the right birth spacing, right? Take early childhood development also. Maternal education is a big driver. Availability of playbooks, the play toys and books in the household, right? So those are things that seem like educational sector, but if the child has developmental delays, they're coming back to the health system. So if there's one wand, magic wand, and all of this that we do, so all of this that we do, we see from a very, I want to crash maternal mortality. I want to crash under 5 mortality. I want to improve contraceptive prevalence rates and things like that. But all of the things that we do have a higher goal. What do we want? We want a prosperous society. We want a society with social cohesion. We want a society where where our country's GDP means that at GNI level, at individual level, people are actually, earning and living well and able to sort of achieve their full potential. So we want good human capital for a prosperous society. And so increasingly, I think seeing we need to see our investments, whether it's in health or in education, as part of a broader and longer term strategy. That yes, there are immediate gains to be made. You can increase life expectancies. But of what value is it to increase a life expectancy if it doesn't translate into prosperity for that individual, right? So really, and unless and until we're seeing that these issues multidimensionally, we're not able to connect those dots. So if I had a magic wand, the magic wand would be, and then everybody says, oh, my issue is multisectoral, and think that their issue is multisectoral. All of these issues are multidimensional. Many of these issues are multidimensional, and that obviously makes governance around these issues challenging, but makes it all the more important, right? That where you think you're investing may not be where your outcomes are going to come out of, and that's really important for progress to happen. So magic wand would be to get myself and all of my colleagues to start to think in very abstract, well, probably many of them probably already do think in abstract terms, but to think in really, really, really multidimensional spheres.
Wow, I definitely agree with you. We need to think outside healthcare. The problem of health, like you said, I can't remember the word you said. The problem of solving healthcare lies outside healthcare. I think that's so true. Thank you so much. We're going to wrap up with two questions. The first question I'm going to ask you, because obviously I'm sure you've been doing this for a long time. Like I said, I need to come and take lessons from you because, come on, like I don't know how I know you've done a lot in this space. But in the health innovation, that's one space I'm interested in, the health innovation space and the private sector. And I'm sure there have been a lot of days where you're like, I'm tired. I don't want to do this anymore. And these people, they don't want to change, behavior. Also, all this, I'm sure you've had those moments, obviously doing this for a long time. What has been that principle? Will I call it quotes? I always ask my audience that because I say one day I'll put everything on my own word because there are days where I'm like, I beg, am I the one that carried the word problem? Let them solve the word problem for themselves. What has been that quote that has kept you grounded? That every time you think about you know why you started this and you keep going for this. So maybe you give me that. And then my second question would be if you were to look back to when you started your career, right, as a woman in healthcare, several years ago before you started all this great work you've done, what would be that advice you give to your younger self, from maybe your youngest self when you started your career, early stage career? And I'm sure you've grown through the ranks. So just look back to that, Dr. Ritgak that just came out from medical school and was trying to of the world, to solve problem. What would be the advice? So those are the two questions for you.
Okay. Okay, so I think I have maybe two simple answers to your questions. The first, what's the one thing? Those moments, they come more than you actually realize. Those moments of frustration, things aren't moving, or you're having a sort of working in a complex environment, challenging colleagues or counterparts. I mean, they're part of the work. The politics, they're part of the work, and yeah, what keeps me grounded is is a very simple mantra, which my husband taught me, actually. He said, water off a duck's back. So water off a duck's
What?
back, off
What?
a
What?
duck's back, off a duck's back, right? So
Okay.
you're not letting it get you wet.
Mm,
You're not letting all of those challenges, the problems, you're not letting them get you wet, and you keep waddling to your destination because you know where that destination is. And I think that's what it is, that these are part of life. They're part of the system. They're part of, you're going to encounter them anyways. What you can control is how you react to them,
mm,
and that it takes, I'll be honest, for me, it took some training, right? I know how easily upset I could or sort of, set off I could be, or how I, like you said, sometimes you're so close to the issue that it sort of weighs you down. Why isn't this
yeah.
thing moving? We need, Nigeria needs to do better, or X country needs to do better, and so on. So I think that water off a duck's back, in that you care enough for the impact to sort of shed off anything that seems like a load or distraction to you getting there. And the second thing is, if I could look back at my younger self, two simple words, two simple or three, a short phrase: have fun while doing it. Have fun while doing it. Every step of the way, because the years will go by. And if you think about it, dispassionately, it is fun. It can be fun work, right? It's not fun that we have these development challenges, but you have to sort of find the silver lining in what you're doing. Just have fun. And it's both have fun at work as well as have fun outside of work. That's really important as well. So have fun. That's what I would
Oh,
leave you
you
with.
love that. Wow, wow, wow. This has been a very full masterclass. I personally am going to go listen to it. And if I have questions, I'll come and ask you because this is actually very rich. I'm sure this is something like 20 something years of your experience. And you're just pouring it within an hour. And I don't think 1 hour is enough to learn from you. But this has been so good. I personally have learned so many new principles, so many intellectual, what did you call it? Intellectual honesty. Actually, this is my first time hearing that. So that's why it's stuck. And I really want to appreciate, everything you've shared here today. This has been very insightful. Like you said, we are gaining to give more, to give back. We're not just giving to give, we're actually gaining to give. And you've done that today, just sharing with me. And I'm going to share with more people are going to share, and definitely there's going to be a ripple effect. Thank you so much, Dr. Ritgak. This has been so fantastic. I'm sure many of my audience would love to connect with you. I guess they can find you. Where can they find you? LinkedIn, or what do you recommend if they would need to connect with you? Yeah.
Yeah, LinkedIn. I'm on LinkedIn, so happy to connect with people, and especially women, young
Yes, I
women.
think Dr. Ritgak is very passionate about women because that page is part of the pioneers, and he is actually very. I actually love the fact that he even gave me a chance to learn from you. I think that is exemplary, like to even glean from your wealth of experience. I don't take it for granted, and I really want to appreciate you. And I'm sure a lot of the people who are going to listen to this podcast will learn something, and definitely you have touched us in different ways. These are experiences we cannot get in the boardroom. And I think maybe we even need to have a master class because there's so many things you touched, about, boundaries, self-awareness, assertiveness, diplomacy, building your social capital. I feel like these are like big words that you are just throwing about, but they take a lot to learn. And I really have learned so much this morning. Thank you so much, Dr. Ritgag. And thank
Thank
you to
you,
all our
thank you so much, Azine. I had fun as well. This was really interesting for me. Thank you.
audience much. So thank you to all our audience who are going to watch this. I hope you learn one or two things from Dr. Rika's journey. You can see that she's a seasoned expert. As I said, if you could x-ray my brain and x-ray my thoughts, I was just in awe. I was like, just wow, the depth of the knowledge. Like, and it goes back to what you had said about the intergenerational. We need that because if I get to sit with you and be around, even if just once in a month, I learn something and I take it into the boardroom and I show up differently. And I think we need to do that better. I'm looking forward to what PWH has in store for us and other women platforms. We need to create that opportunity for transgenerational and intergenerational exchange of knowledge and experiences. So, well, this has been a great experience. Happy Women's Month to all women. And we hope that we have more spaces to share and also to contribute to public health and global health in general. So thank you so much, Dr. Ritgag, and I'm so grateful
Yeah.
to you again for this opportunity. Yeah. So at this point, we're gonna end the podcast and see you again next time. It's the HSB podcast series where we talk about the business of health and what it means to really succeed in pushing healthcare and also running a healthcare business globally. So we have a very, very fantastic guest today, and she's shared all she knows in just 1 hour. I think this has been a masterclass in its full. So thank you, everyone, and do have a great rest of your day. And see you next time when we see. Bye.
Thank